when we're focusing just in Canada with regard to all health issues, access is complicated by geography all
Mm.
the
Of
time.
course.
So period products can cost up to $45. Like a box of tampons can cost up to $45 in Indigenous communities because they are rural and remote communities. And many Indigenous communities also have water advisories, so they can't just use the water that comes out of the tap. So those issues complicate menstrual hygiene. So even within Canada, it's not that we have uniform access or uniform menstrual hygiene management facilities. So we have this necessity to make sure that our solutions are contextualized to the communities that need them. Hello everyone, my name is Roma the Manasker. I'm a doctoral student and director of research at missINFORMED, and you're listening to the Public Health Insight Podcast.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not necessarily represent any of the agencies or organizations we work for or are affiliated with.
Hello, everyone. My name is Purva, your host for this episode, along with my co-host,
Hey, Purva.
Gordon.
What's up? What's up?
Say hi, Gordon. Hi, Gordon. So we've got an exciting episode today. We're looking forward to interviewing a really amazing guest, and we're going to be talking about menstrual hygiene. So May 28th is actually the internationally recognized Menstrual Hygiene Day.
Yeah, and so this guest talks a lot about gynecological care and what are some of those barriers that exist in Canada for people looking to access those services. And some of the things I've read so far are really eye-opening, and I'm looking to deepen my knowledge further to learn more about that.
Yeah, it's going to be an amazing episode. I will look into some organizations that can increase our access to those services. Learning lots. All right, so let's get into introducing our guest for today. Roma Manasker is the Director of Research for missINFORMED, a Canadian youth-led nonprofit that seeks to promote health literacy and sexual and reproductive rights for women and gender-diverse folks across the nation. Roma co-led the research arm of missINFORMED's COVID-19 vaccine information portal, which helped build vaccine confidence among culturally diverse youth in the GTA, or the Greater Toronto Area. She now manages the research and data collection for the Clinic Finder program, which helps young people in Ontario find routine gynecological care near them. Roma holds a Master's of Bioethics from the University of Pennsylvania and is currently completing her PhD in Health Policy from McMaster University. Roma, welcome to Public Health Insight Podcast. How are you doing today?
Good, good. Thank you so much for having me. I'm so excited to be a guest.
We're excited to have you. Thanks so much for joining us on your wonderful Saturday. So let's start by visualizing your career, so to say, on Google Maps, essentially. So,
You got your phone?
she's like,
We
no.
gotta plug your career into Google
I mean,
Maps.
it's topsy-turvy a little
Okay,
bit, but
all right.
I'll get you to the final destination.
Amazing. Let's go on this journey together then. So how did you get from completing your Bachelor's of Science degree in kinesiology to now being a doctoral student in health policy? How did you kind of go through that, and where did you find your passion for menstrual health and gynecology care in Canada?
Yeah, so I mean it's a long and interesting road. So yeah, I did my Bachelor of Sciences at McMaster University in Kin, and that was a great experience and I loved the program. And I think in my second year of my program, I took a course in bioethics and I fell completely in love. And so I took all the courses in bioethics that were offered at Mac at the time. But I knew that for grad school, needed to explore this field more. So I ended up applying to a Master's of Bioethics program at the University of Pennsylvania, and I ended up getting in, so that was great. I went there and I really immersed myself in the field of bioethics, and there the department is called Medical Ethics and Health Policy, and so that's how I got interested in health policy. And so I did half of my master's in the US, and then COVID happened, so I did half of it back home. And then I started to apply to PhD programs, and I knew the supervisor that I wanted to work with, who my supervisor is Julia Abelson at McMaster University. And so that's how I got into my PhD program in health policy at Mac, where I am currently researching public engagement in health policy. So, how do we engage members of the public? And I'm specifically very interested in youth engagement in designing and implementing health policies. And then during the pandemic, I heard about Misinformed, which was very recently launched. And so I've always had an interest in women's health. I mean, I am a woman. And so I thought about getting involved in something during the pandemic. And so that's how I got involved with Misinformed. And within Misinformed, I really have focused on the sexual and reproductive health bit as a woman myself. And as a bioethicist, I'm specifically interested in menstrual access, but also, access to abortions and how that is complicated in Canada.
Wow. That- that's a lot of
That's
different
amazing.
linkages going on, and that's very interesting with the bioethics piece. I found myself becoming increasingly interested in the ethics part of the health discussion, because it's what situations do we go as far as we can, and what situations do we not go as far enough, and working through those things. And I think I'm glad that there are people out there like you working to address that problem. Now, as a director for research at Misinformed, you did mention that you found out about Misinformed stuff. First of all, how did you come to be involved in Misinformed, and then talk about your role now as director for Misinformed and what that role entails?
For sure. Yeah. I heard about Misinformed through social media. So actually, one of the co-founders, Manvi Bala, is someone that I went to high school with. So you never know when
High
you're going
school.
to make a connection. And yeah, a long time ago, and we had drifted apart during university and even post grad, but got connected again because I heard about Misinformed, and I, just reached out to her and was like, "This is so cool. How do I get involved?" And so I initially signed on as a general member of the research team, just creating different resources about health topics that impact women and gender diverse people. And then eventually I applied for the director of research position once our research team grew a little bit. And then I was lucky enough to get that position. And so that was back in, I think, 2021. And so now it's been pretty much 2 years. And so what I do in my director role is kind of manage our small but I think formidable research team. So we research, write, and edit pieces that are related to health topics, which then go on our website, and then they're also translated into smaller, more bite sized informational pieces for our social media. So my role is really managing the team. I write articles as well, but now I'm really more on like the editing and reviewing and fact checking side.
I think the language you guys use for these articles and the research you're conveying is honestly so great, so accessible, and I know that's what you're aiming for, so just kudos to you. It's a really great resource. Definitely go check it out. Can you go into a little bit about what menstrual hygiene is and why it's considered this elephant in the bathroom, I think you referred it to as in one of your articles?
So, yeah, I would say menstrual hygiene is this global initiative to promote safe and equitable access to menstrual products, education about menstruation, and also just the supporting infrastructure that supports healthy menstruation. So, the piece that you were referencing on our website that we kind of published on Menstrual Hygiene Day last year, I believe, was kind of around this educational piece and about breaking the stigma about menstruation. So I think because we call it menstrual hygiene, certain companies have co opted the language of hygiene to kind of promote this message that menstruation is itself unhygienic, which is simply just not true. Menstruation is a natural function that many people will have in their lifetime, and there's nothing fundamentally about menstruation that is unhealthy. And so it's really this supporting infrastructure. Do you have access to menstrual products like a menstrual cup or tampons or pads? Do you have access to, clean water so you can wash your vagina and wash your vulva? And then do you have access to education and all those things that support and go hand in hand with having that infrastructure element and the products as well? Because obviously, if you don't have the education on how to use things and when to use them, then having them is not that useful. So that piece that I wrote was really to call out the industry that, co-ops the language of hygiene to promote the idea that menstruation is unhealthy and promotes the use of things like, douching products and scented wipes, which actually just increase your risk of things like bacterial vaginosis, which actually leads to unhygienic states, and to make sure that our conversation on menstrual hygiene is really around like the supporting infrastructure and not villainizing menstruation itself.
That's a good. I never really thought about it that way, and I did read that piece. So from what I'm understanding from you, the framing around menstrual health, around hygienic or unhygienic, it allows parallel conversations to start happening versus what is clean and what's dirty, and then that creates a market for the industry to create products for people who have misconceptions about what hygiene really is, and they might be able to go in a wrong direction, and then industries can capitalize on that. So how did we get to that point where industries are sort of dictating what menstrual hygiene looks like versus more evidence-based education? What kind of went wrong with those two things?
Capitalism. I
Mm,
like I just feel like at the end of the day they saw that, you know, there is a lack of education about menstruation. There's a lack of
mm,
education about vaginas and vulvas and what a clean vagina and what a clean vulva is. And that just creates that uncertainty creates this market of being like, oh, you know, does your vagina smell weird? Does your vulva smell weird? Do you like feel unclean around your period? Well, here's a product to solve that problem. When really
mm,
the problem, that's not what the problem is. Like you're creating a problem and then you're creating the solution for the problem and then you're creating new problems. So it's pretty wild how this kind of entire industry, this I would say feminine hygiene industry that's,
mm.
very tied in with like the wellness industry as well, has
Right,
emerged.
right.
And unfortunately, it's like taking attention away from the real issues of menstrual
Mm,
hygiene, which is, that people don't have access to menstrual products
right.
and people don't have access to clean water and people don't have access to, safe spaces where they can like change a menstrual product and throw a menstrual product away if they need to. So that's what we need to focus the conversation on.
Mm,
But yeah, unfortunately, these kind of other things that are vying for attention sometimes
mhm,
dilute the conversation.
Even aside from accessibility issues, as you mentioned, in spaces where, in Ontario, for example, I'm not trying to like umbrella term, but for people who have access to menstrual hygiene products and they have access to clean water, but it tends to be that literacy around menstrual hygiene that affects them being able to almost be convinced to use these products. Like, what type of gaps can we be filling there as just normal people also, but in the education? Is it in schools and the general language around it? What can we do?
Yeah, for sure. And I think, breaking the stigma around menstruation is such an important step in the process to kind of, yeah, demystify what menstruation is and what like
mm,
normal menstruation looks like so that
Mm-hmm.
people aren't falling prey to these
mm,
completely unnecessary products at the end of the day and harmful products in the case of like douching and scented wipes. So I do think, starting early in schools is so important, and it's so difficult when sexual education is something that is so politicized and then sees investments with certain political leaders and then sees divestment
Mm-hmm.
with other political leaders. So I feel like it's
Mm-hmm.
constantly in flux and there isn't like this constant stream of resources given to sex ed in schools, which is obviously such a huge issue. But yeah, I think being blatant, saying the words like saying vagina, saying vulva, saying menstruation,
mhm,
saying period in schools, in workplaces, so that we're not still saying time of the month or Aunt Flo.
Or,
Maybe that's an old one,
yeah.
but using euphemisms, like if you can't call out what it is, like what can
Mm-hmm.
you really do about it?
Mm-hmm.
And then I think
Mm-hmm.
in the Canadian context, we should also really think about widening the conversation about menstruation beyond just cis women, because at
Mm.
the end of the day, like non-binary people menstruate, some trans people menstruate, and so any solutions that are implemented that only focus on cis women just exclude
Mm-hmm.
those other groups. So if you think about products in washrooms, like which washrooms, if we still care so much about who is using what washroom,
Right.
then
Mm-hmm.
that's going to have an impact on who can access that product.
Mm-hmm.
That's
Yeah, that's a very fair point.
Yeah, and you just made me think. I just thought of something I came across recently about apparently for federal workplaces in Canada, they're going to be providing menstrual products. So then I'm starting to think now, based on what you're saying, is it in a washroom? And then if so, what washrooms are they going to be provided in? So
Mm-hmm.
then it's more than just access, it's where and then to
Yeah,
whom
like,
can they be accessed by.
yeah, what barriers even exist to a motion that's meant to create some equity? There's going to be some barriers there as well, and to try and like be mindful of those actions is so important.
Yeah, for sure. And when we implement these policies, like we need to be careful and mindful of the exclusionary effects they can have if we're not thinking about the fact that menstruators are not just cis women. A lot of
Mm-hmm.
people menstruate. So
Right.
how are we going to account for
Of
that?
course.
Right.
Of course. So we've kind of been focusing a little bit on Canada and the general barriers that exist here, but how is the rest of the world doing? Like, are there countries that are doing it really well that we can learn from, or the rest of the world can learn from? And what are some places that definitely need some improvement? Or like, generally, is this a public health concern at a global scale?
Yeah, I definitely think, it's a global health issue. Anywhere where there are menstruators, we should care about menstrual hygiene, which is everywhere. So I think it's important to contextualize the conversation and make sure when we're talking about Canada, we're talking about Canada. If we're talking about,
Mm.
I don't know, India, we're talking about India, and we're trying to contextualize solutions as well so that we're not trying to retrofit Canadian
Mm.
solutions on other countries. But I mean, according to the World Bank, 500 million people lack access to menstrual products and adequate facilities for menstrual hygiene management. So you can just like see what the scope of the problem is on a global scale. And I think it is important to look at the issue globally so that we can see what other countries are doing. So I know Spain recently instituted a menstrual leave. So during your period, if you some people experience very painful periods, so you can get up to 5 days off of work to manage your period at home on your own. Yeah, so like great,
That's
shout out
so
to them.
nice.
I'm sure they have other problems that they're facing with
Mm-hmm.
regarding to menstrual hygiene,
Yep.
but they kind of have this interesting policy. So, is that something that we could have in Canada? What might that look like here? I think the federally regulated, having menstrual products in federally regulated workplaces, that's so great. But maybe private workplaces, certain
Mm.
companies are doing better than others in terms of providing products. And then I think when we're focusing just in Canada with regard to all health issues, access is complicated by geography all the
Of course,
time.
yeah.
So, period products can cost up to $45. Like a box of tampons can cost up to $45 in Indigenous communities because they are rural and remote communities. And many Indigenous communities also have water advisories, so they can't just use the water that comes out of the tap. So, those issues complicate menstrual hygiene. So even within Canada, it's not that we have uniform access or
Mm.
uniform
Mm-hmm.
menstrual hygiene management facilities. So we have this necessity to make sure that our solutions are contextualized to the
Yeah.
communities that need them.
And that makes things more difficult. So it's sort of a contextualize on a global scale, and then within a specific region, there can be even more context with access to,
Mm-hmm.
especially with the geographic pieces that you mentioned. There can also be context interwoven in terms of the time period and what's going on in the political environment, what's going on in terms of a pandemic, maybe, and what did that look like. So talk about what the situation looked like before COVID, and then where are we now?
Yeah, I mean, I think before COVID, things were just happening as usual. And I think there are still a lot of organizations that are focused just on menstrual hygiene and making sure that solutions are contextualized. So, in communities where there is a lot of stigma, how can we reduce stigma around menstruation so that people can menstruate in their homes and are allowed to change products in their homes and things like that? And then I think COVID really affected everyone. Obviously, it was like this global thing that just changed the landscape of what access to things looks like. So I think lockdowns, for example, if you lived in a household where periods are extremely taboo, you can imagine how difficult it would be to have a period and not be able to go outside. Or lockdowns might
Or
be
ask someone to
broken, in
get products
fact.
for you. Yeah.
Exactly.
Hmm.
Even in the Canadian context, where perhaps stigma is not that severe, it still exists, but maybe not to those levels. But young girls can still lose access to external supports like teachers and like their primary care providers that provide information about menstruation. And if you come in a household, if you're in a household where, having that conversation is awkward, or you just don't want to have it with a family member, or you don't have a family member to have it with, those are the people that you're going to want to talk to. And suddenly, like, you can't really access them, or at least you can't have that in-person conversation. And then obviously the economic fallout of COVID has impacted everyone, and menstruation is a recurring cost. Most menstrual products are disposable. That's a conversation in itself about like making menstruation more environmentally friendly, but a lot of products are disposable, so that's something you have to like invest in monthly, right? So the inaffordability is something that I think has definitely increased after COVID, or I mean, after COVID.
You alluded to the gynecological care components and how COVID disrupted that. And I want to hold on to that for a second because right now we're going to go into our rapid fire segment called Insight Blitz, where we're going to be asking you questions or read some statements, and you can provide a brief response to those
For
questions or
sure.
statements. Shall
Let's
we
do it.
begin?
Go for it.
What is your favorite thing to do in your spare time? I don't imagine you have a lot of spare time, but when you do, what does
Okay,
that
my
look like?
favorite things to do in my spare time are reading. So you can see I have
I've been eyeing your
I
bookshelf.
have my little mini library behind me. I wish I could say they're all like academic books, but no, they're all like fantasy, young adult, and literary fiction. So, you need your little escapism. And I sing. So I'm professionally trained as a vocalist in classical voice. So that is something I love to do as just like a break in from my day, and then also just like in the car singing my heart out, commuting.
So if anybody drives by
I
you
love
and
that.
sees you on the way to work, that's probably what you're doing.
They're
All
definitely
right.
judging me.
Jamming
Yeah,
out.
they're definitely like, okay.
Or they're impressed, Roma. They might be impressed.
All right. So what is the main reason you decided to pursue your PhD in health policy?
So I think the main reason why I wanted to do health policy is, first of all, because I think health policy has the potential to implement solutions that affect such a large group of people. So I think like the scope of change is so high and impactful. And that's not to say that like individual healthcare providers, they're doing God's work, and appreciate them, of course. But I think the policy angle is something that, deserves attention. I think there's also so many political aspects that intersect with healthcare that we still are reluctant. Or, I mean, maybe we just don't understand, or we're reluctant to like say it out loud that like, yeah, who our political representatives are impact women's participation in society, impact, access to fundamental reproductive health choices. And we need to like call out those problems and, call out our political representatives, because at the end of the day, they are responsible for a lot of access issues, and also maybe responsible for implementing wide-scale solutions. And then I'd say finally, because bioethics, I think, is still kind of navigating this policy space, and it hasn't like fully emerged in that space. And so as a bioethicist, it's a really like cool and innovative space to be.
Hamilton or Philadelphia?
Oh my God, Hamilton all the
Aw,
I'm a Hamilton.
not even a fighting
at
chance for
heart.
Philadelphia?
No, not really. Maybe I didn't live there long enough. I've been in Hamilton since like primary school, so I feel like Hamilton has a special
Yeah.
place in my heart. Hamilton has like culture, it has a personality. Yeah, I love being in Hamilton.
COVID cut your time short in Philadelphia.
Hamilton
though,
called
so
me
we can
home.
blame it for that too.
There you go. So you talked about bioethics quite a bit. So what was your most valuable insight that you learned from your Master of Bioethics?
Oh my gosh, that is such a weighty question. The most valuable insight? Probably my most valuable insight is that, everything is about values at the end of the day. Everything about how you set up your healthcare system, what types of issues get attention, what type of issues get funding, it's all about values. And I think that's another reason why I'm so interested in women's health, because it is just chronically underfunded by research. It's under recognized. Like, just even women academics are less than male academics, for example. So everything is about values at the end of the day. And I think we saw that during COVID as well. Just this idea of like, what do we value? Do we value saving the most lives possible? Do we value, protecting vulnerable populations? Do we value fiscal issues and, economic issues, they're all important. It's just, what do you put value on determines outcomes for millions of people. And so I think I love bio is because it focuses on figuring out what we value.
Okay. I think you've inspired me to get a shirt that says everything is about values at the end of the day. That's probably one of the most profound quotes I've ever heard.
With
Yes.
Roma written at the
From
bottom.
Roma.
From Roma.
That's a
you.
profound insight. I'm glad I
Definitely
asked
keep
that
you up
question.
at night.
Yeah, I could see that. What core skills are needed as a PhD student?
Oh my gosh, what core skills are needed as a PhD student? I think the main core skill is just perseverance and dealing with constantly changing circumstances. So, I mean, I think maybe we all have that skill with COVID and just being like, oh my God, everything is changing. But I think during your PhD, you start off and you have this vision of what your PhD is going to look like, what your project is going to look like. And it's hard because you're so passionate about it, right? Like, this is what you've chosen to dedicate like 4 to 5 years of your life to. And then so much changes, right? Like so much is dependent on like your funding and your supervisor and how much time you have and are you able to get research participants? Does the data exist? Is the data easy to obtain? Like there are all these little things that happen along the way. So I think you need to persevere and you need to just open to change and just embrace the fact that your project is probably going to change like a million times but you're getting ready to defend.
All right, so you heard it, folks. PhD is no joke.
Yeah, definitely writing is an important skill too. That's one that I wished I developed earlier on.
All right, that brings us to the end of our Insight Blitz. I'll throw it back over to Purva to take us into our conversation on gynecological care.
Yeah, let's take that pin that Gordon put into
let's go
this
back to
topic
that
earlier.
pin.
So gynecological care, what exactly does routine gynecological care entail? What does that mean? Like, what does it include?
Yeah, so I wish I had a
Ah,
routine, simple answer for you, but it is something that routine gynecological care to me is kind of those basic necessities, those recurring needs that you have as someone with female reproductive anatomy. So it's things like cervical cancer screening, STD checks, those very routine, recurring things that present in your life. And the reason why this like kind of classification of routine is like not something that's set in stone is because currently some primary care providers do provide forms of routine gynecological care, but
mm,
every provider is providing
Mm-hmm.
different things. And it's so hard to figure out who is providing what.
right,
Our clinic finder is like figuring out
right.
what are these routine things, where can you get them, and establishing that having a primary care provider who does those things is obviously not necessary. If your primary care provider doesn't,
Mm,
they can refer you to a gynecologist who definitely will. But having a primary care provider who
mm-hmm.
provides those services is important for a lot of people. Like your primary care provider is the doctor that you see the most often, or a nurse practitioner that you see the most often. They're probably you're most comfortable with them. And unfortunately, the referral system in Canada is just not simple, and it can be very hard to get a timely referral to a gynecologist. And I've definitely, I've had that experience, so I can say that it's definitely true.
I think in the one of the pieces that you wrote, you mentioned that it could be up to 12 weeks sometimes for people to get referred to a specialist in like an OBGYN, for example. So,
Yeah.
and then at the same length, you talk about there's a lack of standard for what would be considered routine, and therefore there's a lot of variability in terms of what different primary care providers are offering. So talk
Hmm.
us through. You mentioned you put your policy hat on, your ethicist hat on, and one of the things that I gleaned from reading one of the pieces is about a petition to have gynecological care be integrated into primary care. And you did touch on why that's important. So can you talk to us about what that would mean and how that would work?
Yeah, for sure. So, yeah, there was this change.org petition that was honestly, I think, started just by a person who had so much
Mm,
difficulty getting gynecolog like seeing a gynecologist and getting the referral from their primary care provider, that they started this change.org petition saying that half the population is going to need gynecological care. Why is it so difficult? Why is it not a part of primary care? And making it part of primary care means having making sure that primary care providers have the education and the
mm,
training and to
right.
provide gynecological care in their offices, that their offices are equipped to provide that type of care, that we see it as a standard practice that primary care providers should be providing this type of care, and then obviously that patients know about it and know that their primary care provider might be someone who does this, and if they're moving primary care providers or if they are seeking a new provider, maybe that's something you want to ask for and that's something that you want to select for. But right now, as I said, because this idea of what is provided, who is providing it is so complex and difficult to figure out, and there's just a lack of standardization between primary care providers, it is really something that you have to figure out on your own.
Yeah, I know. Like, just in my own experience, I've been going to the same family doctor for years and years. And I didn't even know that he does the pap smear in his clinic until I
Mm,
asked about it. And I was like, hey, can I get referred to a gynecologist? I need to get like a pap smear done. They're like, oh, we do it here. I was like, okay,
mm,
why was I not told this? Like, it would have taken away so much barriers that I thought were there, because I know how long it takes to get a gynecological like a specialist appointment. And the fact that in your article you said for emergency it takes up to 7 weeks, like that's insane. It's quite difficult to deal with. So it seems like you mentioned it briefly. Clinic Finder would have been really helpful for something like for my case, where it would have been nice to know if my clinic did do these routine quote unquote gynecological care. Did you want to go a little bit into what exactly Clinic Finder is? Explain it to the audience and what resources can it kind of provide?
For sure. So yeah, Misinformed recently launched our clinic finder back in February, and right now it's Ontario only. But essentially, what you can do is you can go on our website, click on the clinic finder, and then you can put in your postal code or your general region, and then it's going to pull up a list of primary care providers near you, and it will also list the types of gynecological care that they provide. So, yeah, cervical cancer screening, STD checks. It will outline what types of gynecological conditions that they have experience with. So things like premenstrual syndrome, premenstrual dysphoric disorder, amenorrhea, dysmenorrhea, it will list all of those. And then it will also, something we're trying to do is list kind of the types of care experience. So does this provider know how to provide trauma-informed care? Do they know how to provide culturally sensitive care? So it has details about that too. So, we're kind of recognizing that all this information is all over the place, and you're going to have to, if you're just looking for a primary care provider, you're just going to have to go hunting through their websites, calling their clinics. And so we're trying to be a centralized hub where you can easily access that information and hopefully find a primary care provider who meets your routine gynecological care needs.
Yeah, I think it's a fantastic tool. There's other similar ideas out there. How is Clinic Finder kind of different from Healthcare Connect or Doctor Search, which maybe some people know about?
Yeah, for sure. So, Doctor Search is good if you're just looking in general for any kind of family doctor. I would say Doctor Search is actually good if you want to see if there are any concerns on a file of any particular doctor, because the CPSO has all of that information. But it's so broad. Like, I don't think you would find necessarily detailed information. Healthcare Connect is also nice. It's like this feature that you can connect with a nurse who's going to help you find a provider. The only thing with that is I believe that you cannot currently have a primary care provider. So if you're currently with a primary care provider, you can't really use Healthcare Connect. Whereas you can use the clinic finder on our website anytime you want. If you're just looking, you're not sure about changing primary care providers, or you're just looking and you're looking for a resource for someone else, it's going to be helpful. It also filters by walk-in clinics. So, if you're kind of, in a bit of a, oh, I don't know what's going on, I need to see someone right away, I want to walk in, it's going to identify those clinics, walk-in clinics that provide routine gynecological care. And then it'll also tell you which walk-in clinics provide a referral, since not all walk-in clinics do. So obviously primary care providers can't do everything, but if you do need to be referred to a gynecologist or an OBGYN, that walk-in clinic would be able to do that for you if you filter by that provides referral ticker.
It's amazing.
Yeah, and I didn't even know about, I know about the Doctor Search because I did work in a pharmacy once upon a time, but Healthcare Connect, no idea that I could just put my name in and someone would help me find a family doctor. No idea about that.
For sure, yeah.
And
it's a great service.
And the fact that Purva was seeing her family physician for years and that conversation never came up about those services. So there's really, like you said, it was understated perhaps, and I don't think that was your intention. I think it's just it underscores the broader system at play in terms of, you said, and they know about it. So it's not only that the resources are made or the environment is supportive for people with female anatomy who need menstrual health and gynecological care, but also that they know about the resources that are available. And Misinformed, one of your mandate is to do just that, to understand where the gaps are, develop those resources, and make sure that people know about it. And it can't be stated enough. So taking everything into account then, Roma, if you had a magic wand to change any aspect of menstrual health in a way that it currently is delivered and gynecological care, what would be the one thing you'd want to change?
That's an interesting one.
You're itching her bioethics brain there.
Yeah.
I know.
I didn't want to tell her what hat to wear.
What are your values?
What are your values?
Yeah.
I'm going to start every question by asking what are your values before I answer a question. That's great.
I mean, if we're focused on gynecological care and these routine forms of care, I would really like to make it so that every primary care provider provides routine gynecological care and that there's
Mm.
some consistency in what that means. And I think it's just because, like, your primary care provider is that provider. Like, they're your central hub. Like, they're the person that you should be going to for those recurring health issues. And it just feels like such a, even just like a mental barrier to think, like, oh,
Mm-hmm.
I need to like book an appointment and find a referral and figure out how to get to a gynecologist. And maybe it's someone new, it's someone you're not comfortable with. And then you have to build that bond all over again for something that, if you're getting a cervical cancer screening, that's like every 2 years, you know what I mean?
Yeah.
So it's so much easier to just go into your primary care provider's office and get that done. And I had the exact same experience that my primary care provider offered it, and I had no
Mm.
clue that they did.
Isn't that so
I asked
strange?
for a
Just like the
referral.
accessibility's there. Yeah. The accessibility's there, but you don't know about it. And
Right.
that's a barrier on its own.
Oh my gosh, yes, I know. And then if I could wish for something for misinformed, it would just be like infinite funding. So that we can expand Clinic Finder for like all over Canada, and yeah, and make it something that, obviously, it's addressing something that is currently like a problem. So obviously solving that problem would be the best solution, and then we
Mm-hmm.
wouldn't even need Clinic Finder.
Right.
But, until we reach that reality, Clinic Finder is there.
We'll wish it into
Mm-hmm. And
existence.
that speaks to what you touched on in the beginning about it's these systems navigation pieces that has created an opportunity in the market for the feminine hygiene product industry to come in and perpetuate misinformation and capitalize on that. So the argument isn't, oh, you didn't know because you don't have a family doctor. You did have a family doctor and still didn't know about how to navigate the system. So there's something systemic
Yeah,
there, and that
exactly.
perhaps creates a vacuum that the market can capitalize on from these products that do more harm than good.
There is for sure such a large systemic gap in how to access information. I mean, we're definitely in an age of like too much information, I would
Too
say. Like,
much,
if you
yeah.
just search up menstrual hygiene into Google, you're going to get like a million hits, right? And then Summer's Eve is going to be like paying money to be near the top of that Google result. So you're going to click on them. Like, it's all these intersecting issues with, like, obviously capitalism intersecting with health, and then intersecting with sexism and patriarchy and how all of
Yeah.
that operates. And it is so complicated. So at Misinformed, we're really trying to be that one-stop shop of information, that if you come to our website, you're going to get information you can trust about the health topics that you care about. You can see all, like, we cite everything. So if you really want to go and like check and make sure, like, go for it. And if we get anything wrong, call us out on it, because at the end of the day, like, we want to be that trusted source of health information, and we want to be like your best friend who knows everything, who you can trust when they're telling you something. And that's why it's really important that we, continue to stay as a nonprofit, we continue to stay youth led. So we are really like by youth, for youth, talking
Mm.
about the health issues that we care about, and trying to share information so that everyone can make informed decisions about their health, because we all deserve that.
Amazing. Honestly, it's just so inspiring. Go check out Misinformed, you guys. To wrap up this amazing conversation, Roma, did you have any take-home messages for our audience?
Take home messages. Okay, related to Misinformed, check out our website. So that's missinformed.ca. And you can find us on like every social media that exists, like Twitter, LinkedIn, Instagram, Facebook, TikTok. All the
Okay.
Yeah, TikTok
Yeah.
too, yeah. And then I would say follow Menstrual Hygiene Day. Be aware on that day and tuck it away as something that, yeah, May 28th, that's a big day, that's the important day, but it's something that should be an everyday issue. It's something that we should care about every day. And also, menstruation is not unhygienic. It is hygienic. It's completely natural. You smell normal during your period. You're all good. And if there is something that you are genuinely concerned about, skip the Shoppers Drug Mart feminine hygiene aisle and genuinely go and talk to a doctor that you trust, because these types of products, they are just gonna cause problems or cover up problems that you might have. So yeah.
If I could interject and also add, pharmacists are great to at least start the conversation too. So if you're in the aisle and you're stuck and overwhelmed with the choices available, pharmacists are a good place to start, in that they are already in the pharmacy and they can give you some initial advice and perhaps encourage you to connect with a healthcare provider like a family doctor. So I just didn't want to
For
miss
sure.
that
I know
piece too.
pharmacists are also able to prescribe now.
There we go.
More. So yeah, that's definitely something to look into, especially for like yeast infections and UTIs.
Right. Yep. Exactly. Exactly. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.